Hello, my name is Brian Gomes, and I'm the President and CEO of BMS Canada Risk Services, and I will be moderating today's session. During the past several weeks, we have heard from many healthcare professionals with a range of questions, including what financial support they can access from government, best practices for adapting to changing care delivery such as telehealth, overall health and well-being, as well as personal financial management assistance given the current circumstance. To answer a range of questions and provide more detail on these topics, we have compiled a panel of experts. You will hear from Dr. Karen Cohen, a psychologist and the CEO of the Canadian Psychological Association, Fred Phelps, the Executive Director of the Canadian Association of Social Workers, Todd Burke, Senior Partner at Gowling WLG, Larry Hassan, a CPA and Director at McIntyre and Associates, and Stephen Roster, Senior Wealth Advisor and Associate Portfolio Manager from Scotia Wealth Management. We will be asking each speaker questions that we have received from health providers during the past few weeks. Please note this is an opportunity for content sharing based upon information available today, the 4th of May. As you know, the situation is extremely fluid and is changing on a daily basis. Please continue to regularly visit your associations, colleges or governing bodies website, as well as canada.ca for up-to-date information. We will not be taking live questions during this webinar. However, at the end of the session, I will share contact information to assist with additional queries. We will be recording today's webinar and it will be made available through various channels such as your association's platforms. I will now ask our panelists a series of questions. First, let's begin with Todd. Todd, a common question that has come in is how do I handle professional liability issues during the pandemic? And also have the questions coming in from various professionals to the pro bono legal hotline changed during the COVID crisis?
Thank you, Brian. Let me start as every lawyer should, and that's with a disclaimer. Every situation is unique and will be guided by their own facts. So as a result, my comments today cannot be viewed as legal advice. If you do have a particular question on a particular set of facts, you should reach out and get legal advice on those. So the question, how do I handle professional liability issues in the pandemic? Now, while the pandemic is unprecedented, that doesn't mean that all bets are off. The regulations, standards, and guidelines of your college still applies. Your conduct should continue to be governed by those directives, and you should consult your college with respect to what those are. The college is always a very useful place to start. Their websites tend to be quite informative, and they have been updating those as the crisis unfolds. Now, as you indicate, Brian, the COVID-19 scenario is somewhat unprecedented, and it will raise issues that have never been contemplated. And I can tell you that from our experience on the Pro Bono Hotline, which is a service for members of the associations that are insured through BMS, we are seeing some questions which are different than the ones we typically deal with, but not a large number. So it's probably the case that if decisions that are being taken in the COVID-19 timeframe are going to cause issues with regulators, we will likely see those at some time in the future. But I think there's a recognition that in all of this, we're all finding our way. And some colleges are better than others in terms of giving direction to members as to how they should conduct themselves. And I'm hopeful that the colleges will look to the reasonableness of the members' actions in light of the existing standards and the existing regulations and guidelines and directives against the backdrop of a very different and unprecedented situation. And while we expect reasonableness on the part of the colleges, reasonableness will also be an expectation of members as well. In the existing framework, there's a considerable amount of discretion that a member can exercise in terms of whether a particular service is of an essential or urgent nature or not. The Chief Medical Officer of Health in Ontario has left that to the discretion of the health professional. And as I said, some colleges are also providing direction on what constitutes urgent care. Where urgent or essential care is required, it is recommended that it be delivered via telehealth. But there will be, and this is one of the topics that we've dealt with on the pro bono, which is different, and that is in some disciplines, such as psychology and social work, there may be a perceived need to actually see a patient to avoid a threat to the patient's immediate safety. So you sort of say to yourself, well, what type of questions should I be asking where that may be necessary? And the advice we give is a five-fold test, if you will. Is the client truly in need of urgent and or emergency care? Two, is it possible that the client cannot access telephone or video resources? Or the session is not suitable for remote service, given the client condition as determined by the professional? Can all social distancing protocols be met? Are both the client and the professional comfortable and able to meet public health recommendations when either traveling to the meeting site, at the meeting site, or when returning home? And lastly, has a fully informed written consent been obtained to proceed in this particular fashion? So ultimately, at the end of the day, you've got to be able to rationalize the decisions that you have made, and they have to be reasonable in the context of the regulatory and legislative framework that we are working in. Now, that doesn't mean that you may not face the scrutiny of the college at a later date, but it certainly will give you a good basis to respond. And the last thing I would say is, remember, you are not alone in all of this. If you are in doubt with respect to a question of client care, then reach out. And there are many good online resources. We've talked about the colleges, but also as part of the service for members, we have the pro bono hotline, and there you can get a half hour of free legal advice on matters relating to professional liability. It is not an employment hotline, it is a professional liability hotline, and those are the questions that we restrict ourselves to. So those would be my thoughts about how to handle a professional liability issue in the COVID context.
Thank you, Todd. You had made reference to telehealth in your answer, and that's certainly something that we have seen a significant rise in the usage of during today's circumstance, and that we will also likely see continue into the future. So with this increasing use of telehealth, how can a health provider ensure that the exchange with a patient remains confidential?
Well, you're absolutely right. We're seeing a considerable increase in telehealth across all of the regulated health professions. And the popularity of telehealth has put the question of confidentiality into the forefront of many professionals' minds. And I would say at the outset, one of the most important things is to have a comprehensive written consent in place, whereby the clients give his or her consent to receive treatment by way of telehealth. The consent would note the risks of receiving treatment through this medium, and one of those risks may be the potential loss of confidentiality as a result of a problem with technology. And I think that is the first thing. The second thing, which is equally as important, is that in addition to the consent, I think in your medical records, you should be documenting the fact that the consent has been provided, but also that you've had a conversation with the client that this is the way that the service is going to be delivered. and that they are aware of the risks associated with this particular service. Now, I don't think that your obligations end there. I think if there is a problem, a regulator is going to want to ensure that you've done your due diligence associated with whatever platform you have chosen. And not having carried out that kind of due diligence, we are not in a position to recommend any one particular platform over another. That is an exercise that you need to carry out yourself. But we can say there are certain questions that you should be posing. One is the information that you and your clients transmit secure and private? Does the company that you're using, do they commit to maintaining the confidentiality of the information that you and your clients place on the platform? Is there end-to-end encryption in place? Is the data stored on servers in Canada? And while there's no legislative requirement that the server be in Canada, it sort of avoids you getting ensnarled in the laws and jurisdictional requirements of another country or place. Does the company and its employees have access to the information that you and your client place on the platform? It's an important question. What steps does the company take to make sure that the metadata does not identify users, including health providers and their clients? What does the company do with the metadata that is collected? Has the platform's security been reviewed by an independent third party? And how would a breach or vulnerability be addressed by the platform? So at the end of the day, you want to ensure that you are an informed consumer and that you can demonstrate to a regulator that you've carried out adequate research and have chosen a platform after appropriate considerations like the ones that I've set out here today.
Thank you very much, Todd. I think that's all extremely important information, particularly as we adapt to a new and changing environment. The importance of maintaining, key principles and guidelines while we do so. So thank you. Let's shift our attention to both health and well-being. We're very fortunate to have both Karen and Fred on the panel today. So let's start with Karen. Karen, a question has come in around, how does an event like COVID-19 affect people psychologically, and what are some things that we can do to cope? Karen, you might just be on mute. So if you try coming off mute, if that's okay.
Sorry about that. Okay. Sorry about that. Thanks, Brian. While some of us will be physically affected by the virus, all of us are going to have to cope with its risks psychologically and socially. Like any life stressor, a health emergency, or a pandemic challenges our ability to cope. It's important to keep in mind that it's really normal to feel worried or upset about something like this. We're fearful for ourselves and the people we care about, particularly the people in our circles who may be more vulnerable. The other thing that can happen with stressors is it can trigger feelings or memories of past stressors, and so our reaction emotionally can be compounded. Also important to keep in mind that everyone copes differently. People get stressed, stress doesn't get people. So the way you cope may be different from the way your partner copes or your parents cope. People who tend to be more worried might be those who have a pre-existing condition, so they're at more risk perhaps for getting the virus or having severe consequences. People working on the front lines obviously are in more risky situations. They may feel more worried. People living alone or who have few social supports may be greater impacted psychologically by the effect of a pandemic. Worry shows itself in the usual ways. It affects our sleep, our appetite, our mood, our use of things like alcohol. It's important that we monitor our reactions. If we have too much distress, too often, and too many signs, those can be times when it may be helpful to reach out for some help, either to your family doctor or to a mental health provider. In terms of how we can cope, the good news is people are pretty resilient. So we're able to bounce back. We're able to weather things like this. It's important that we take care of ourselves and also our community. And that's going to be the key to success here, accepting and giving help and support, knowing yourself, knowing what's going to help you to relax and feel better and weather this pandemic is really important. Take time to relax, do the things you enjoy, exercise, sleep, and eat well. Try not to cope in ways that aren't so good for us, like using alcohol. Really important to connect with others. We're fortunate that unlike 20 years ago when we wouldn't have all the technology options to stay connected, we have them now. Important to use them. Maintain routines to the extent possible. Stay informed, but look to credible sources, and limit how much and how often we listen to the news, because all COVID all the time is probably not going to be the best thing for mental health. Follow the guidelines of experts. Obviously, it's really important. Getting through this, as I said, is going to be a community taking care of itself. And then the final thing I'll say in terms of coping is try to spend your time thinking about things you can control rather than things you can't. So we can control how well we sleep, how well we eat, staying connected with others. Can't control so much when it's going to be back to normal, when we can return to work. So it generally will be a more effective coping mechanism to try and spend our energies on the things that we can control.
Certainly. Thank you very much, Karen. As many individuals adapt their workplace and environments, do you have any specific suggestions about working from home that are effective for the worker, for their families, and also, widely for the workplace?
Sure. We're at a place now where lots of employers had work from home policies. So making this transition may not be, as new to everyone as it might have been some time ago. But of course, we had to move very abruptly to all the time. So that can be challenging. People have different circumstances at home. And so, different folks are going to find different solutions. To the extent that everyone can, it's important to have a dedicated workspace, even if it's one that you've got to clear at the end of the day because you need to eat on the dining room table. During your work hours, having a dedicated workspace, as much as you can, having the technology you need to support you doing your work, creating comfort and quiet in your work environment to the extent that you can, maintaining a routine and a schedule. All of things are important, including taking breaks, lunch breaks, coffee breaks, walking around. There's a certain amount of flexibility that comes from work from home. You may need to take a pause to attend to something your kids needs or to answer the doorbell. But it's important that you also limit your work hours so that it's not all work all the time. So to the extent that you can create routines, really, really important. Very important for employers to be really clear about their expectations at work from home. Do your roles and responsibilities change in any way? Are there things you have to do or do differently because of the constraints of working from home? Really important to have communication about what those are. The good communication that you have with your colleagues in the workplace is really important. It can sometimes through email, it can be more complex or take a little longer to clarify something that a conversation could do rather quickly, but clarifying it is important. So if you're not sure, ask and ask again. And then creating really good boundaries with family and with colleagues, particularly if you're working at home with kids. Instead of saying things like, we'll do that later, maybe work with the kids to develop a routine and a schedule. You know what, at 5 o'clock, I'll be done. We're going to play Monopoly at that time. It gives them something predictable to know when your work time ends, and they can expect you to give them attention. And I'll just end with just a couple final thoughts that really we need each other to stay both healthy physically and psychologically. We need to stay connected. We need to ask and accept help. And I think we need to be generous and kind to each other so that we can all be our best selves during this stressful time.
Thank you, Karen. There's some excellent information and tips and feedback that I know many will appreciate. You touched on the effect that the circumstance is having on people psychologically, and certainly it is taking its toll on families. There are new pressures and stress, and the unprecedented dynamic of this circumstance has a varying degree of impact. And so, moving to Fred, and with that said, Fred, can you kind of give us some feedback on making practice or business a safe space for people and children that have or may be experiencing a form of abuse?
Thank you very much, Brian. And yes, I can. And I was going to build off what Karen had just said. We need to be generous and kind, and I would like to also put aware with that, because I think we need to be aware that not everybody around us has weathered this isolation in the same ways. Meaning, a lot of us like to say we're all in this together, and to a certain extent we are, but for another extent, there's a whole segment of people, mostly women and children, that are isolated at home right now. And they're on a day-to-day basis, their escape from whichever situation they're in, whether it be mental, physical, sexual abuse, is going back to school or going into the workplace. And for many people, and it's worldwide, unfortunately, the recognition that in the time of isolation, that's a tool of an abuser, and those that are in abusive situations are getting abused, and it's not necessarily being reported, especially in the child welfare end of things, as it typically would be. But as employers, being aware that this is happening, being aware that you're in a privileged position, that potentially this maybe not be happening in your life, but with, as you said, Brian, with the stressors of life that have changed, with the economic stressors, with such, those that may be inclined to abuse other people in different ways, have ample opportunity without eyes of the community being able to be on and reporting. So it is a kind of a difference between virtual and in person. And so I think if you're looking at your space in the virtual space, it's very difficult to know what's really going on behind you, behind the screen, when someone's doing a virtual call with you. So I would refer people to the Canadian Women's Foundation has a great program on, and I would just Google Signal for Help, and it's violence at home, and it's a real simple one hand up with a thumb.
Thank you, Fred. I think we've that the line may have been just cut short for a second, and so we'll just move on and maybe come back to Fred. Are you there?
Yeah.
Perfect. Okay, great. Sorry, I think the line probably dropped on this end. So just to follow up to that, you touched on awareness. Is there a duty to report child abuse or neglect if someone is aware?
In terms of children, yes. And in most provinces under 18 or under 19,
I think we've just lost the line again. So we'll continue with that and provide information as it relates to the duty of reporting, which Fred had confirmed that there is, but we'll provide more context to that in follow up. So just shifting gears from mental health and well-being to the financial side of the circumstance and the effect that this is having on many Canadians and healthcare, professional healthcare practitioners. First, we'll touch on kind of government assistance and financial management. And Larry, if you could answer some questions for us, just touching on some circumstances that a number of health professionals are finding themselves in today. The first of which is being, someone's clinic is fully shut down and they have to work virtually, but are earning less than $1,000 a month now. Are they eligible for any programs?
Yes, thanks, Brian. So, if you're an individual that were either employed or self-employed person, and you're laid off or earn income or a salary that is below $1,000 a month, you would be eligible for the 16-week Canada Emergency Response Benefit. This benefit pays $2,000 a month. If you realize you haven't applied for that, you can apply retroactively via the Canada Revenue Agency website through My Account or Service Canada website. Just to make sure ahead of time you're set up with direct deposit, because that'll allow you to receive the funds faster. You should note that this is a taxable benefit, and you will be required to pay tax on this amount when filing your personal taxes for 2020. And if you earn more than $1,000 a month, at this time you would not be eligible for that program. If you had applied for the CERB program and after the fact realized you were not eligible, you should contact Canada Revenue Agency or Service Canada, as you'll be required to repay these benefits. A lot of healthcare professionals are in a tough position as they fall within the gaps in some of these programs, but the federal and provincial governments are adding and modifying programs as more needs are being identified. So it's really important to follow the announcements, go to the canada.ca website and see whether any of the programs going forward would apply to you if this one doesn't.
Thanks very much, Larry. That's very helpful. Just kind of a follow-up to that, and a circumstance I know many health practitioners, particularly clinic owners, find themselves in today. A question that's come in is, my small business has employees, but they have all had to be laid off now, and I have to pay rent and overhead. Is there any assistance available to me? And are there other programs that may assist me, my family, and my business, such as perhaps commercial rent subsidies or any provincial or municipal programs?
Yeah, that's a good question, and I'll probably break that question down into a few parts. For the first, let's assume the business was paying some salaries. So that would just be payments to employees, or even if you're self-employed by your own business. So for those that continue to pay employees, then there'd be two programs available for the business. There'd be the temporary wage subsidy that works out to be 10% of salaries paid, up to $1,325 per employee and $25,000 per employer. This program is administered by a reduction in remittances. The larger the program or the bigger program is the Canada Emergency Wage Subsidy. This is a reimbursement or a subsidy of 75% of the wages paid to employees, capped at $847 per person per week. This subsidy is income tested and generally requires a 30% reduction in revenues, 15% for the month of March, to apply for that subsidy. Both those programs are live and can be applied for on the CRA website. There are potentially large penalties, though, for the abuse of any of those programs, and they can be a little bit tricky to calculate and apply for. So be sure to consult your accountant for guidance on that. In addition to the above, the government is providing assistance with overhead and rent via two programs. There's the Canada Emergency Business Account. It's a loan and requires a payroll in 2019 in excess of $20,000, but not exceeding $1.5 million. The loan is for $40,000, and there's a potential for a $10,000 forgiveness if repaid before December 2022. This loan has to be used for non-deferrable operating expenses and non-deferrable expenses. It cannot be used to pay a bonus or refinance existing debt. This loan carries no interest until December 2022. The government also recently announced a rent subsidy program, which would be subsidized up to 75% of your rent for those that have a significant income drop of more than 70%. Details about that program are expected to be released shortly and should be available to be applied for sometime in May. If you're not eligible for any of the above programs, or they're not sufficient, the government has also rolled out programs with the BDC and EDC to administer additional debt offerings, which you can inquire about via your financial institution. And as a general guideline that I've been suggesting to clients is use this as an opportunity to create a personal business budget or cash flow. Determine how any of these programs would impact your budget. Decide if you need to defer your personal mortgage, loan payments, or any other programs. You can inquire through your banks on that. And you can then look at any additional provincial programs or city programs that, as they're rolling out supplemental programs in your local jurisdiction, which I suggest you go to those websites to see which ones are available to help. The key is just to make sure that you're preserving cash flow, not only to cover your living expenses, but also enough working capital to resume normal business operations when things finally open up.
Great, thanks very much, Larry. A lot of really important information on assistance in different channels, and thanks for pointing all of those that I know a number of healthcare individuals and small clinics and so on are in need of that help. So very much appreciated. Just kind of moving on to our final panelists, Stephen. And Stephen, maybe more broadly, how has COVID-19 impacted the economy and financial markets? Maybe if you can touch on where things will go from here, and what are Canadian banks doing to help in the circumstance?
Sure, thanks, Brian. Finance is an area that has been significantly affected in several ways by COVID-19. Not only have personal incomes been disrupted, portfolios have been very volatile, and certainly the viability of some business entities have come into question. In terms of markets, from the peak in late February, global stock markets fell by more than 30% to their trough on March the 23rd. But more importantly, the speed at which the decline happened was historic. We had many days of extreme volatility that was unsettling, to say the least. Since then, we've experienced a relatively strong rebound in April, but consensus suggests this is based more on sentiment factors, including hope and optimism. And unfortunately, the last few trading days have seen fundamentals come back into focus, and markets have started to account for the harsh economic and corporate data. But really, as you mentioned, the big question is, where do we go from here, and what does our recovery look like? We know second quarter GDP is going to be pretty unsettling and catastrophic, but we're seeing economies around the world begin to tentatively reopen. We've also seen unprecedented levels of fiscal and monetary support provided by governments and central banks. The purpose of these programs is really to keep families and businesses afloat during the pandemic and build a financial bridge to the other side. In terms of economic recovery, the most desirable, but not necessarily likely outcome is what we refer to as V-shaped. That is, the economy moves sharply lower as a result of forced shutdowns, but is followed by a sharp and rapid recovery as economies are reopened. We believe this is an unlikely scenario because it would be like flipping a light switch and returning to pre-COVID conditions. This is not possible because it would necessitate travel and group gatherings to return to normal. The next and more likely scenario is one in which we see the same sharp decline in economic output due to forced shutdowns, but then we see a more gradual recovery as economies tentatively reopen, demand starts to gain traction, confidence improves, more viable and effective treatments are developed, employment continues to improve, perhaps a vaccine is developed, and things start to look more like they used to. This has become known as the Nike swoosh recovery, or it could also be thought of as a dimmer switch slowly being turned up to make the light brighter. The fact is, we will recover, but unlike any previous recession, our recovery is directly linked to science. In order to truly emerge from this pandemic-induced downturn, a significant event needs to take place. Will a viable treatment that restores confidence in travel and group gatherings be discovered? Will a vaccine be developed in record time? Will our population develop herd immunity? These are all unknowns, the answers to which will become much clearer in the coming months. In terms of what Canadian banks are doing to help our citizens during this challenging time, all of our Canadian banks have developed financial relief programs for Canadians who have been impacted. These include payment deferrals on mortgages, personal loans, and credit cards, and interest relief may also be available on credit cards. It's important to remember, though, that everyone's situation is different. Using a payment deferral option will increase the interest costs over the life of a loan, so it's important to carefully evaluate your financial situation and priorities before using these options. People who are negatively affected by COVID-19 should visit their bank's website. These have a tremendous amount of information available, including instructions on how to apply and calculator tools that illustrate the increased costs.
Thank you very much, Stephen. That is a lot of interesting and important information as you know, as things evolve and assistance that's being provided financially today. Just in terms of your experience and how have clients been reacting to all of this volatility that we're experiencing today?
Well, simply put, everyone's different, and clients react very differently to market volatility. Some view this crisis as a generational opportunity to buy stocks at a steep discount. In these instances, I promote caution. We've dealt with volatility many times before, but never has the cause been a global health crisis. Only time will tell if this turns out to be a once-in-a-lifetime opportunity. Others become very fearful and panicked, making emotional decisions to sell their holdings at bargain prices along with the herd. This is never a good idea and only benefits the investor on the other side of the trade. In these situations, I try to keep clients focused and patient. I fully recognize this can be difficult, but we need to remember the true value of a company is closely tied to its long-term earnings and not what we're seeing due to a shorter-term disruption. I think it's also important that clients look at their situation in life. And I think this sort of falls into two different categories. For those who are still building towards retirement, they should recognize this period as a temporary disruption, but as not as something that will derail their longer-term plans. They should stick with their plan and continue their saving strategies along the way. Ultimately, continuing to contribute new capital to portfolios during volatile times will be rewarded over the longer term. For those who've already retired and rely on income from portfolios, this disruption can be particularly unsettling as portfolio values move up and down, and income from dividends and interest become less certain. For this group, we always recommend they maintain a level of cash that is at least enough to cover 12 months of desired income. While not being fully invested leads to some foregone income, the peace of mind that comes with this strategy far outweighs the drawbacks. I suggest that all people in this group ensure they're following this strategy so they can be less concerned with short-term fluctuations. The bottom line is, no matter what type of client you are, it's challenging circumstances like these that make working with an advisor pay off. Your advisor will help you stay focused and level-headed and keep you on plan.
Thank you very much, Stephen. That now concludes our webinar for today and the Q&A session. If you have any feedback or would like additional information, please connect with BMS at info.canada@bmsgroup.com so that we may direct your query to the appropriate party or one of our panelists today. I'd like to take this final moment to sincerely thank Karen, Fred, Todd, Larry, and Stephen for today's session. While they were all very different and broad topics that we addressed, they are all equally important to the current challenges that we're facing today and helping us to get through the circumstance that we are in into a brighter future ahead. I hope each individual listening today found value in the session and can make use of this information during this time. Thank you.